your time and good morning.
Good morning, sir. Man.
I hope you're well.
I'm blessed. What about you?
I am also doing well. I know you have a lot of
Um,
questions to answer from the media this morning, but fortunately for you, you will not be doing that. Your boss will face it. So, but in the meantime, just some foundation. First, what is primary health care?
Thank you very much. Health service has been classified into at least three stages. We have primary health care, where it starts from the CHIPS compound. CHIPS compound is Community Health and Planning Services, which is so primary health care starts from CHIPS through health centers, polyclinics, to district hospitals or municipal hospitals. So at that level, you have primary health care at that level. This includes basic health care, curative, preventive, and promotive. The malaria, the vaccination, visit to home to make sure that people are fine and not done at the basic level. Some minimal surgery or operation are also done at the district level. So basically, pre-primary health care is to provide health care at those levels. The care we provide at those levels are referred to primary health care. And then you have the secondary care. Secondary care is also the original hospital. You have some level of specialist who give various care. And at this level, they do further surgery, provide extra care, specialist care. And then you have the tertiary level. At the tertiary level, like the teaching hospital, you include care and teaching to put the two together. While taking care of the people, we are also doing some learning, providing a lot of insight into what you're curing, what exactly we are dealing with. And that's if you have consultants, you have specialists, various medical offices taking care of complicated healthcare issues. So this is what our healthcare service is made up of.
I see. So from chips all the way to district or municipal hospitals,
Yes,
every service that they offer there goes under primary health care.
exactly. Exactly.
Okay. Now explain to us what you are launching tomorrow.
So what we are doing now is to make sure that we prevent diseases before they go to the hospital. What we are doing now is to take the hospital to the people. What we are doing now is to remove financial barrier and make sure that every Ghanaian living any part of this country receive health care regardless of his financial situation. We want to put it in a plain language, arrest the diseases before they become critical, before they damage our system, before they kill. So persons will be visiting, health professionals will be visiting homes. You see them at marketplaces. New health kiosks are currently being put up at marketplace. If you go to Medina Market now, you see one. Go to some parts of the country. We're currently doing some health kiosks to be closer to the people so that if I'm on my way to the work and I'm not feeling all right, I can just dash in there and quickly they take care of me, provide some advice, and give me some medication for me to continue with my work. So we are looking at promotive and preventive healthcare under the program. What you need to have the identification or what uh, criteria there is for you to benefit is for you to be a Ghanaian. Identify yourself with any identification number or card in Ghana, and then you access it. If you have a voter's ID card, you can access it. If you have your Ghana card or passport, you can access this care at any part. But we are starting this from the CHIPS compound to the polyclinic for now. So if you go to a CHIPS compound, you receive it. If you go to this medicine kiosk we want to place at various points, you receive free primary health care. If you go to polyclinic, you receive free primary health care. What have we done so far? Because we know that there's a new program and it's going to have a lot of people rush to these places. We have procured about 500 million worth of equipment to be distributed. Knowing very well that after taking care of the people at that level, they will go to district hospital. We are providing equipment from the district level to the CHIPS compound across the country. We will start this in about 160 districts and gradually add on the rest of the districts in the coming months. These are some of the things we have done. We have also gone around, done some survey, trained some persons who will take care of some of these programs that we are introducing, especially the free primary health care. So, Sana, to the Honorable Minister for Health, who would appear at the Government Accountability Series and announce the various packages and how this program is going to be rolled out. And on Wednesday, His Excellency, the President of the Republic of Ghana, would launch this program. This has been a dream, and this week it will come to. If you look at, I have been a health reporter in the past, and I've written articles on quality health care at the basic level. There has been a dream. Various governments have tried to make healthcare accessible at that level and also make it stress-free. This is the beginning of that dream.
I see. Very interesting. So you're saying healthcare, any type of disease you take to the CHIPS compound all the way to the polyclinic, after this launch will become free.
That's correct. But the curative, that is curative. That is curative. Curative is already being taken care of by the health insurance. The free primary health care is roping in the preventive and promotive care. We've identified that under the Mahama care, a lot of the diseases they are being taken care of currently are things that we could have prevented earlier. So I've gotten people to go around the various areas, advise, give some medication, some advice, and then they would have been fine. But we left them because maybe the person is also a market woman, must go to work every single day. Based on that, he or she was not able to see a physician to advise him or her. So we want to now take care of that. We won't wait for you to be rushed into a hospital and you are told there is no bed. Because I keep saying that if you have all the beds in this country put in one facility, you will still have no bed because people will not one go through the preventive aspect. They will wait until they reach the dying stage before they are rushed to the hospital. So we want to now arrest the diseases from the start, prevent them from happening, prevent them from killing us, or prevent them from capturing our nerve system before we are to rush to the hospital. So the free primary health care basically will look at promotive and preventive. The curative is already there, but under the program, it will still be taken care of at the basic level.
I see. That's interesting. Well, we'll be looking forward to the launch though, but I wanted, because you brought in the National Health Insurance Scheme, so I wanted to ask, at what point does the National Health Insurance Scheme come in? Or now it won't be used at that level at all?
So, after all of this, if you are referred, if you are asked to go to access further care, you need a health insurance. So that will come in handy. If you're advised, oh, do this, go and see a doctor here, go and do that. You go there, your health, because you have health insurance, you don't need to be looking for money. You don't need to be scared because you've been asked to go and see a doctor. You know the health insurance is there to take care of it. The hospitals, as I speak to you, are ready, are happy to see even health insurance come to their facilities. Because of the uncapping, health insurance is paying promptly, and they are ready to receive health insurance in any facility. So that is the beauty of what we are currently doing.
And what about the cost? Because a lot of what happens I'm sure, and I don't have the numbers anyway, but significant number of people end up at the facilities you mentioned, CHIPS to polyclinic. Has a cost been considered, and how do we intend to pay for it?
Yes, this free primary health care is part of health insurance formula, the payment under health insurance. So it's being taken care of under the health insurance.
Okay.
The total cost, the Minister for Health will do those announcements today.
And that's why I'm being careful not to take the wind out of the sail. But tell the minister that after he's done, he has to come to the studios. So we have a one-on-one conversation on this.
And get him, knowing how his schedule will be this week.
No, this week he has to clear his schedule in the morning at some point and come here. But then there's also the issue of because you now do is it Ghana Medical Trust Fund?
Yes.
And then primary health care.
Yes.
Do they have any relation at all?
The only relation we have now is for us to let people know that free primary health care will prevent the number of people who will be rolled onto their platform. They will be the diseases will be prevented before you get there. But the coordination is not clear. There are two different institutions, two different programs doing different things altogether.
Well, we'll be looking forward to that announcement later today and the launch, and then we'll continue this conversation. But thank you, Tony.
Thank you, sir. I'm grateful.
Yes. So a few things will be happening. So today, the minister will be before the Government Accountability Series that's hosted by the minister responsible for government communications at the Jubilee House. We'll speak to the press, take questions, and then tomorrow there'll be the launch of the free primary healthcare initiative. And there will be a lot to talk about. So just to put you on notice that is what is happening today and tomorrow. That's the first part. There are many other things that we'll be talking about this morning, including the fact that the NDC UK Ireland are launching an IT project. We'll be finding out from them what that project entails. But tomorrow...
they're still in the business.
Yes, yes. The business...
They are not giving up.
Give up where? It is their party. Who says they should give up? Why?
Hey, Chawa Conrad. They are still in the business.
Oh, they are there.
Never give up.
Yeah, they are there.
Okay, I see. We wish them all the best.
Yeah, I think one of the newspapers, I don't know if you can, it will be difficult for you to find, but there are papers. See, there's a paper that shouts, boss margin must stay. There's a script, there's what they call a screaming headline with the exclamation mark, boss margin must stay. One of the papers actually has that on their front page. Now, this is the Daybreak newspaper. Now, as government moves to cut fuel taxes, very interesting view they have. And they are arguing that the decision by the government to reduce fuel prices in the next pricing window brings to the fore the relevance of certain taxes and levies on petroleum products and how they should be maintained. One of such levies is the boss margin, which goes to Boss Energies Limited Company for the development and maintenance of the company's infrastructure for strategic storage purposes. Boss margin as of today is pegged at 12 pesos, and it is the lowest of all the levies on petroleum products. Boss Energies is Ghana's strategic entity for energy security, and current happenings on the international front should inform the nation of how important it is to empower the outfit to absorb shock in times of crisis, and that is going on, and it's going on today. Now, the boss margin has come for some discussion because the Institute of Energy Security is one of those who holds a contrary opinion to this. We'll be sharing with you what the IAS is saying on the boss margin, the issue of the boss margin. And we'll be talking about what some of the options available are. Because if you recall, there was a cabinet meeting. The cabinet meeting happened on Thursday. At the meeting,